So welcome everybody, and thank you guys for attending. This is a crazy turnout. Izabella and I were like, well, we might get 5 or 6 people. We end up with like twice or 10 times that much. We're very excited you guys are here in beautiful Temecula, California. So I'm Don Armstrong, and this is Izabella Gieras. We're going to do some introductions in a few minutes, but I wanted to introduce our presentation today, Opportunities and Challenges in HTM. And you see there's a question. We want to encourage some kind of conversation. I know we have a lot more people here than we kind of expected, so we will kind of keep track of how long we're going on this presentation. But a lot of our slides kind of actually invite a question. Are you ready for the new opportunities and challenges? So session overview, HTM is a very dynamic field. As we know that it's ever changing day to day, of course, year to year and day to day. And there's opens up a lot of doors and then some opportunities. And there's a lot of challenge for this. Depending on if you're in a big hospital, small hospital, third party like me, I work for Renovo Solutions, so we have a lot of different challenges than maybe Izabella, who works for a hospital chain. And they range from how we recruit, retain, how we train our folks, how we keep our folks, how we recognize our folks, to all kinds of different things that we face every day. I like to think of challenges as opportunities, so you're going to look at me as a guy that sees things, the glass half full all the time, even overflowing all the time. So I like challenges in our field. I really do. I see them as opportunities. As a technician, I used to love getting service calls because that was just an opportunity for me to go up and meet somebody and learn something new. So that's where you're going to get from me. Same thing from Izabella too.
Oh, they're all here for you, Don.
They're all here for both of us. Agenda. We'll do some introductions in just a second with Izabella and myself. Current HTM landscape. I was out to dinner with my son last night, and he said, "What is HTM again?" So for those of you who don't know, does everybody know what HTM stands for by now? Someone say it.
No.
No? Huh?
What does it stand for?
Our technology management. Our industry's been called biomed, clinical engineer, all kinds of different things. Years ago, we went through like a naming. We had a big group to get together and say, what do we name ourselves? We came up with that healthcare technology manager.
Hey, Don, before you go any further, HTM, how many of you have adopted the name and are actually called HTM department?
You have.
Oh, any of you are thinking about it? Challenges, opportunities to HTM name adoption? Oh, you're thinking? Okay, got it.
Yeah, it's kind of not a bad name for a department. It's kind of a hard thing to call ourselves an HTM, right? And I'm a healthcare technology manager. I used to be called a biomed. I still call myself a biomed, right? And clinical engineer. We get that a lot too, but Izabella's maybe an engineer, but I don't know too many other people that are working out as a working biomed or clinical engineer. So, it's been one of our challenges even to this day, is how do we identify ourselves as a field, right? Objectives are, we're going to review a little bit of past, present, and the future landscape of HTM, explore some resources needed to support the evolving HTM industry, and explore some opportunities and challenges. Yay, the slide worked. Okay, Izabella. You see the little brown dot right there, that's you.
I was going to say, if anybody knows, or what is that, when you're looking for that, that little guy in the middle of.
Oh, where's Waldo?
Where's Waldo? I said if you guys could see the dot. Thanks, Don. We appreciate everybody here, first and foremost. We, as Don indicated, did not expect to have such a good turnout, so thank you for joining us. I know lunch is next, so hopefully we'll make it as entertaining, but also engaging, really. The slides do prompt for a discussion with all of you. I know we have a bigger turnout today, but that shouldn't prevent us from hopefully what's going to be a lively discussion. So a little bit about myself. Currently, I work at 2 hospitals as part of the Cedars Sinai health system in Southern California, in the LA area. One of them is Cedars Sinai Medical Center in Beverly Hills, and the other is Huntington Hospital, or actually Huntington Health, as we've joined the Cedars Sinai health system in Pasadena. I have been with Huntington for, this August will be 15 years, and have joined Cedars as part of the partnership almost 4 years ago now. Prior to that, I actually had the pleasure of working with Don at Mount Sinai Medical Center as part of our Aramark engagement there. He was, I think, just moving, right? Moving to New York yeah. From California. And then prior to that, worked what is now a much, much bigger system in the southern part of Michigan, Beaumont, William Beaumont Hospital in Royal Oak. So that's where my clinical engineer career started. I've had the pleasure of being part of ACCE. I don't know if we have any members here of ACCE other than Michaela, who is actually our secretary for ACCE. So he's on the board of directors there. But we, of course, are always interested in recruiting members. So pitch for ACC while we're here. A certified clinical engineer, as hopefully some of you in this room as well. And then some academic degrees. I'm originally from Poland, just to give you a little bit of the journey, because you're probably thinking, where's that accent coming from? But my family moved to actually Middle East and then South Africa, where I spent most of my high school, my undergrad. Had the pleasure of meeting my husband, who's also Polish, so we had to go all the way to South Africa to meet each other, and then ended up in Connecticut, Michigan, New York, and now California. So here we are. Okay, all right. Am I next?
You're next.
All right, so a little bit about the two hospitals. As part of the affiliation, as I mentioned, almost 4 years ago, Huntington Hospital became part of the Cedars Sinai Health System. Cedars also owns Marina del Rey. If any of you are familiar with the Southern California area, there is a new hospital that's going to be coming online at the end of next year that we're starting to get more, or have started already to be more and more involved in. Torrance Medical Center, Memorial Medical Center is part of the system as well. And of course, Huntington very actively is a very active, what I call a very active affiliate within the system. A little bit about the department. So clinical engineering, talking about the different names. At Cedars, we have clinical engineering. At Huntington, we have clinical technology, actually adopted through Kaiser name of clinical technology. So potentially at one of these days, hopefully in the future, not too distant, we'll be looking at consolidating those names. But a little bit, I won't go line by line through all the statistics, but we're very fortunate to be licensed for many beds, fortunate, unfortunate. So we do staff to that. We have a staff of over 30 individuals, BMETs. We have clinical engineers. We have imaging specialists. Michaela is our manager. Myself and I toggle between Huntington and Cedars. And of course, some support staff with over 30,000 devices just at Cedars. Many of them, of course, we manage in-house, but we, of course, do have quite a few service contracts, especially on the high-end equipment, and report to IT. Huntington, similar, but as I always say, 3 times less the size of Cedars. So when you think of staffing, number of beds, equipment-wise, some of the specialty equipment-wise, and so on. Again, won't go through too many details of here from the list here, but again, the department is about 12 individuals. That includes myself. We also have BMETs, a CE, 1 CE, a manager, because again, I toggle between the 2 sides. It's important to have some strong support at each side. We don't have the imaging specialist that you saw on the other side. I know imaging has popped up many times in just the less than 24 hours that I've been here. So I know it's a big topic, how to build, especially in-house imaging departments and so on. And just over 10,000 devices and roll up to the same IT that Cedars main rolls up to as well. And there you are. Do you want to have this?
There you go. Feel myself sitting up here getting a little bit nervous and getting ready to talk, but then I get to talk about myself. That just eases my attention right away, because I love to talk about myself. So I am currently the technical training manager for Renovo Solutions. I've been with Renovo since June of 2020, right when COVID happened, and my wife and I were transitioning from California to Florida. And right when we got to Florida, the pandemic hit. My wife was starting up her own nursing consulting company. I was going to help her, and then decided I wanted to get back in the biomed field after like 2 or 3 months. And so I started on a journey to get a hold of all the equipment companies that were building ventilators, and they needed people. And I started calling everybody I knew to see where I could go, where can I help. And one of the owners, Sandy Morford from Renovo, heard that I was looking, called me and said, what are you interested in doing? And I said, I want to get back in. I want to start working as a biomed. Hired me as a biomed for a couple of years, worked with Rachel Jornovic right over there as one of our VPs. And then I got offered the technical training manager in 2021, and I've been there ever since. And I love it. Lifelong biomed, been doing this for 43 years now. Started when I was 21, do a little bit of math, you can kind of figure out. I'm a 60-plus-year-old guy, so the way I've been doing this. It's all the only job I've ever had. And I really do believe that, you know, I feel we're all put here. I think biomed's more of a calling than it is a job, and it is a career. I mean, I hope that people are in this room are thinking as HTM as their career, not just their 9-to-5 job. Because once you flip that switch to make it into a career and your life's work, it really does kind of propel you to where you care about what you're doing, you know, as opposed to just going to work and punching a time card, right? Love the HTM field and what it's done for me and my family. I mean, I've got my family here is watching today, the first time they've ever been here. That's why I'm kind of looking this way, so I don't get so nervous by looking at them, but they're here today, and my son and my wife are both here. I worked at Stanford Healthcare for about almost 30 of my 42 years, mainly in the OR. Worked at UCSF and GE Healthcare, and also with Aramark, with Izabella. That's when she and I met about 16 years ago, and we've stayed great colleagues and great friends ever since. I'm on faculty with Amy. Also, I teach the CBET review course with Dave Scott from Colorado. We have been doing that with him for about the last 5 years, so I've been able to, you know, train and work with that program for quite a long time. We did a little figuring out the other day. We ran through about 1,200 people through that program in the last 5 years. That's a lot. You know, we're hoping that a lot of them have taken their test and got certified. I am CBET certified, CHTM certified, and most recently CABT certified. And I'm hoping that your entry-level technicians are taking that CABT. I took it so I could find out what it was all about. It was a fun test, interesting test, and challenging for maybe a brand new biomed, but I encourage all of you that have new biomeds to go down that path. I've been on a lot of boards with Amy, with the Technology Management Council editorial board, Amy Standards Committee. I was a past president of HTM in Texas, out in Houston, and I belong to quite a bit of other local biomed association, CABMed and CMA, and lots of other ones. Again, it's all about engagement. It's all about buying into your career and what you want to do, right? Not to talk about my wife too much, but she is a nurse, and being a nurse is not a career. Being a nurse is a calling. Being a doctor, they always say that it's a calling. For me, being a biomed is like a calling. I really do believe that that's what I was put on this earth to do, to share my technical and personal skills with all the clinical partners we have and all the people and the patients especially. So here's our graduating class of one of the training sessions we did recently. This is our phase 1 training session. All these folks right here are pretty much brand new to the field. I've been in the field maybe anywhere between 1 month to maybe 2 years. Brian just went through phase 1 a while back. I think if it's Brian in this class, no, Brian wasn't. Yeah. Huh? Yeah, there he is. There's Brian right there. Yeah. So Brian just said at that point had just taken the CABT and was coming to us and saying, yeah, come on, everybody, take the CABT. But yeah, this is what we do. We work in collaboration with CBET College of Biomedical Equipment Technology in San Antonio to put on some of our training programs. They are awesome. Okay, so here's a little bit of the past, present, and future. You see we have the blue dot there. I'd be calling on you to talk about this one, but
good. And I keep on looking, when is my turn?
It's your turn.
Don was kind enough to put those dots there, so we know when we have to switch.
Yeah, it's funny. We just went through a small group, and that was one of their tricks. The husband and wife did a small group, and they put like a little dot in the corner so they knew who to speak. So I just adopted that. So reactive, past, present, and future of like kind of what biomed does and HTM does. I still call it biomed, right? We want to transition from when it breaks, fix it, and it breaks, hello. Fix it when it breaks, PM it for the guys in the basement, for the people in the basement, men and women down in the basement. We want to make sure that we're a little bit more than that. We want to transition to somewhere where it's going to be, I'm hitting the wrong button, Isabella.
Don't break it.
I'll get there. Where'd it go?
You're good.
I've been trying to hit the red button. There we go. To preventive maintenance, condition-based maintenance, and predictive maintenance, and all that stuff's going to be based upon data that we're going to be learning how to draw and pull into actually those kind of metrics that we need to go. So the past is, you know, let's face it, I could stand up here for an hour and a half and talk about the past and the present and where we should go. We're going to let that kind of sit right there. Okay, Isabella.
My dot?
Your dot.
Where is it? You missed it.
That's for me.
Oh, there. Oh, okay. So you will see some slides that we've used that have some statistics, some data that we pulled. Not necessarily all exactly relevant to HTM, but some of it is obviously still indirectly relevant. So a lot of data on here. I won't go through each one of them, but in terms of some of the, and let me now make sure I press the right buttons, but in terms of some of the growth predictions, AI infusion into healthcare technology. I mean, who hasn't heard of AI and many of the vendors talking about my equipment now can do this, and this is how we're going to infuse artificial intelligence into the new design of the equipment. Are you guys doing anything with that yet? Has anybody adopted anything, even with any applications that will help you kind of look at some of the more predictive models using AI? Have you heard the vendors talk about it yet?
Just when I'm getting ready to send an email and I want to put it through ChatGPT and make it look decent.
It's there. The most recent presentation we had when we were looking at fixed imaging, some of the vendors have talked about some of the advantages and some of the, not even futuristic, it's really the current technology and how they're infusing that into helping, the end users, the physicians, the physicians, the nurses, and this was specific to radiology techs, make some of those decisions, right? There still has to be a way to obviously validate that. I don't think we're necessarily there yet, but it's starting to be more and more prevalent with our technologies. So you will see, as we've heard so much about telehealth, virtual reality, a lot of data crunching. Now AI is starting to obviously becoming a thing, and I'm sure you will see and hear more about that.
I think one of the newer healthcare trends also is a VR training.
Yes,
I don't know if,
yeah.
because I know that one of the companies we work with actually has the headsets, and it's not that far from now that we'll just be sending you out a headset with a manual to go along with it, and actually put you through a training program through a headset versus having to send you somewhere. So that's coming. It isn't there yet, but I think that's going to be the future of it. We think it might be a fad. It might just fizzle out, but I've gone through some of them. It's confusing to me. Maybe because I'm old and it's just confusing, and I don't want to be standing on top of a CT scanner and then I'm sitting there floating around on the floor because I accidentally jumped on a CT scanner. But so most of it's pretty good.
Yeah, I think they had some demos at the last AMI using virtual reality. I don't know what they will have today or tomorrow at the Expo.
Probably, yeah.
Never know. Maybe it's there. So again, some statistics as we talked about. Who wouldn't want to be staying? Well, know that if you absolutely have to go to a hospital that looks like this, with little what we call Moxie, because we have Moxie robots at Cedars Sinai, and they definitely take over the hallways when you're trying to get through. They won't necessarily stop and they block your way, but it's a reality. It's happening. You have robots delivering supplies, right? You have supply chain uses them for some of the bigger deliveries from unit to unit. So it's not necessarily a thing of the past. So some other statistics, I mean, this is probably something you hear over and over. I know many of us look at that when we try and justify positions, right? Some of our challenges with staffing, I'm sure many of you share that. We have a lot of that happening in our institutions. How do you justify additional body, or even when you have to replace, you still have to justify why you need to replace the individual that have left. I think there was some interesting data here in terms of some of the growth that's being projected that's specifically related to biomedical equipment technicians. 13% growth from 2022, obviously into 32, so a 10-year growth. I'm assuming that may even be bigger as technologies, IT-based, future technologies, IT-driven. There is going to be a greater and greater need with people with high skill set. And of course, a discussion for some of you that have attended the leadership summit today, heard that over and over, making sure that clinical engineering, HTM, biomed, however we want to call ourselves, depending on what name you have adopted, to make sure that you have a seat at the table, right? In order for all this to happen, we need to make sure that we work with all our friends around that table and more. And I don't know if the vendors are, yep, we have a vendor right there at the head of the table. But it's so important. It's really a full circle. And if you haven't made any of those connections, or you don't know your CNO or CNE, your COO, your CFO, for that matter, it's very important to know them. Please make sure that when you go home, whether it's you or the leaders that you have in the clinical or HTM department, it's a good time to make those connections. I guess that's me.
It's still you.
You moved my.
Oh.
I was going to hide the IBM, but HTM. They're chasing after HTM, not IBM. But anyway, so funny. So again, as we start to talk about opportunities and challenges, I mean, one of the things that we've talked about, what do we talk about, right? It's a very relevant topic, but at the same time, we can, talk till we go blue, but we really want to also hear from all of you. What are all your challenges and opportunities? So hopefully we'll have some, like I said, lively discussion soon. But a lot of the things that we want to do as part of our HTM departments, first and foremost, make sure we have some, oh, now I'm doing what you're doing. Smart goals, right? Nothing's going to work if you don't have smart goals. Don't come up with goals that, just because they look great on paper. They may be a good opportunity, but they could turn into a challenge very quickly if you're not able to support them. So think about that as you do your smart goal setting for the year or for the quarter, whatever that may be, as the new year starts or as your new fiscal year, you may be on a fiscal year too. Optimize scope workflows, right? Who doesn't talk about Six Sigma, optimizing workflows to make things easier, become more effective, become more efficient? Cost savings always comes into it. A lot of it, and again, I feel like we've talked about that also in the last 24 hours, is data, right? How good is our data? In order to be able to come up with a better process or even start a project to support process improvement, you need data, and you need clean data. How many times do we talk about garbage in, garbage out, right? Whether it's with our CMMS systems or whatever other applications you use, to be able to use the data to help you improve the workflow or whatever that may be that you're trying to optimize within your department. Communication, that kind of goes without saying, and I know it's a broad word. It could mean many things, and communication can go in different directions, but communication in a sense of also that multidisciplinary groups, right, that we talked about on the previous page. You may have data, but you may need also help from all those individuals to be able to support your process improvement. That could, again, it could be a challenge, or that could lead to opportunities. So it could go different ways as well. Customer satisfaction, skill set, a lot of that stuff, the challenges that we face, do we have the right skill set in our department, in our departments, in our institutions, right? Do we need to recruit certain individuals that can help us with some of those activities? We've talked about end of support, end of life, recall management, and so on. Maybe you need somebody in your department, again, tight budgets, right? So some of it may be repurposed, or who doesn't want an additional task to their existing task, but to have a dedicated individual that can help and develop that skill set to be able to work on some of those essential activities. The other one is the 3 Rs, which is really, it's a presentation that, well, I feel like we've touched on, and I touched on that in our previous presentations over the last few years, but I did one at the Amy last year, and it's really the recruiting, the recognition, and retention. How many of you are quite satisfied with those 3 Rs, right? Who doesn't have a challenge? Probably everybody has some form of a challenge with at least one of the Rs, if not all of the Rs. So obviously looking at investment in your staff, whether it's training. Who knows about EQ? Not the IQ, but the EQ. So it's kind of the opposite, right? You don't just think about, the IQ of the individual, but you're developing some kind of a emotional intelligence. So you're starting a connection, whether it's with your employees or any of the individuals we had at the table, right? Including the vendors, to be able to relate, get to know them. I'm not saying, go deep down into the personal level, but establish that emotional connection. That goes a long way when you want to continue to have a long-standing partnership with those individuals.
And I'm a firm believer that EQ really plays well in biomed, because I've always said this many times, that being a biomed is primarily a technical profession. It's also a relationship profession, as far as I'm concerned. You know the people you work with and the people you work around, you can have that kind of connection. You could really get stuff done much more efficiently, make them feel better about their equipment. Go up there and be the helping hands. Don't be just someone stuck down in the basement. You want to be that, have that emotional intelligence to be able to interface with people. I mean, luckily for me, that's one of the God-given gifts that I have, thank goodness. But other than, I don't know about the IQ part of it, but the EQ part of it, I'm not bad with. So thank goodness, right? So communication and EQ, I'd even like to think it's even more important nowadays than the technical skills. We could teach the technical skills. We could find those technical skills for you, and find out what you're good at. That emotional intelligence stuff, it's really big.
Yep, the connection.
Sorry I spoke on your dot.
Oh, that's okay. I've seen where we have 2 dots. That means that we can both
Yeah, we can
talk.
both speak.
We'll come to that. But any thoughts, any comments so far? I kind of wanted to pause. I know we've had a few minutes into the conversation. Anything anybody would like to share or bring up?
You have a question?
Oh, question. Yeah.
Question more of a comment about it. At the end of the day, it's patient safety, and you have to care to do your job better.
Absolutely right.
Yeah,
Who teaches you that whole caring piece of it? I mean, is that something that during onboarding orientation, they say, hey, listen, you got to care. During you look in your resume and you see you've had 4 years of biomed this, you got biomed school degrees behind there. You get hired because you look like you're going to fit the job description. If someone telling you, listen, you have to be nice to people. You have to care. We had a guy talking about today about he was from Kaiser, and they really have a culture of, hey, listen, if you're at a meeting because you were showing somebody how to get to their appointment and you're going to be late, that's fine. That's what we kind of want from our employees, to show compassion. So it's a really hard one. I mean, it really is. And I'm a firm believer of modeling that behavior as a leader, or anybody who's sitting in this room right now, just being here, you're already a leader. You took a step out and you came to a conference, you came to a presentation, you came to an educational session with us, which was very nice. But again, model that way for somebody. Be that person to show somebody it's okay to go up to a patient's room. It's okay to say good morning when you walk in to a patient. I mean, that's always been kind of a taboo-y type of thing. I don't know if taboo is a word, but taboo-ish kind of thing. You know, can I say hi to a patient? Can I do that? Is that kind of out of my scope, you know? But just know compassion is such a huge tool. I mean, it really is. Maya Angelou, I'm not a big quotey kind of guy, but most people, she says, most people don't remember what you do, it's how you make them feel. And that really does carry. It really is carry.
Yep. Yeah, definitely. I know we have probably some graduates of recent biomed programs in here. Does any of that education come into play, or is it just kind of a pass through, or is there some kind of a dedicated, maybe a class or a course on this? Anybody can speak to that? The more practical, technical.
I don't think you can train somebody. I think you can model it. You're following somebody, you learn that way. But I think it's kind of a skill that people lose.
Yes.
Well, I'm gonna step out here. Rachel, what do you think about the importance of communication? Because Rachel was I'm the technical trainer. Rachel really came to me and said, no, I'm gonna prompt you, if you will. She came to us and said, what are we doing in the realm of communication? And do we have something in place we could formalize? I know it's kind of hard to say, formalize a training program that focuses on communication and networking and ethics. You're right, because you just hire somebody, you don't sit down with them in your orientation as a manager and say, you will be ethical, you will communicate, you will smile at people. How do you say that? Or it doesn't sound like soft skills. They just say, screw the soft skills, I'm a great technician. Well, the world needs that too. But Rachel was actually one of the biggest drivers for our company to start saying, yeah, we need to focus on the communication, because you started getting asked about it, right?
I think we may, as leaders, make an assumption that it's a basic skill, basic life skill, and think we can't assume that. It's like you said, it's something that some folks are better than others. It's inherent, it's natural for others, and others need a little bit of coaching on it. So it's, I think we've all said it here, it's probably one of the most parts of our jobs. And to make an assumption that folks have that skill is, it's a core part of building the foundation of a strong technician, a strong leader.
Right, exactly. Yeah. Sorry to put you on the spot, but I know that you were there. I wanted to bring you.
You did good. Excuse me. So I know there is obviously some training that we can do, and hopefully many of you will go back and look at that. I know, just before we move on, because I know we have to move on, but there's a lot of programs. I know at Huntington Hospital recently, the AIDET program, I think some of you may have heard.
AIDET?
Right, AIDET.
Yeah,
Don't ask me what it all stands for, but it's basically for, on the Huntington side, EBS, Environmental Services, has to go through that program. As they enter the room, and the room is occupied with a patient, how do they address the patient or the family in that room to be able to go into that room and do the work that they need to do, right? I mean, it could be the same with our biomed staff that has to that has to, oh, excuse me, that has to go in and also introduce themselves, because there may be a patient monitor or infusion pump that's beeping and they don't have it, you know, that they haven't had a chance to switch it out. So very important skills, all kind of comes down to EQ. Okay, I think that's me again.
Yes.
All right, technological advancements. All right, so continuing the focus areas. Are you prepared, right? We talked about AI. I mean, we're getting more and more infiltrated with all the IT, you know, connections and systems, you know, alarm management and many more. RTLS, I mean, some of you may be taking on some other technologies that may not be the most traditional for clinical or HTM departments, right? So we have to be able to support that, support our staff, and support ourselves too as leaders to be able to address those changes, because they're opportunities, but again, quickly could also lead to some challenges if we're not ready and prepared for them. Manage budgets, I think that's pretty self-explanatory, you know, always asking or being asked to do more with less, right? Who hasn't been asked that, right? Budget cuts. Excuse me. Networking, internal and external. When Don was putting some of the presentations together, when he put networking, I just assumed, you know, networking as in connections with people. Well, I think you were thinking networking as in the IT side of it, and how clinical engineering obviously is becoming more IT driven. So networking can have so many meanings, right? In this case, talking about internal, external, again, that seat at the table, introducing yourself to the new manager. Like, how many of you get, because we get them ever so often, get an email, new manager, you know, Joe Doe is starting on 5 West, and that's a medical surgical unit. How many of you use that email and reach out to that new manager's assistant or to that manager directly and say, hey, I would like to schedule half an hour meet and greet so I can introduce myself. I can introduce my department. If you have some handouts that talk about your department, take those with you. Take those handouts of the PM stickers and the different colors that and what they mean, right? Because that manager will have to know that. How many of you do that? Ooh, 1. All right, good. Please do that. When you see that email, manager, director, or because we don't get those emails obviously for every person that joins the hospital, but any of the leaders, especially the clinical leaders or the end users that that you would work with, right? That you want to have that partnership with. Turn that email into a connection through some kind of a meet and greet. It doesn't even have to be half an hour. It can be 15 minutes, can be 10 minutes, or grab a cup of coffee with an individual, whatever works.
It's an opportunity, right?
Yes, definitely is. And you know about it because it's there. It's announced that somebody new is joining the leadership team. And again, you know, that kind of puts your, you know, department on the map. So the question here, as we talked about the engagement from all of you here, what is on your list? Obviously, this is not an exhaustive list. It's just some key points. Anything that you have on your list, any high-level opportunities, challenges, or anything else in general at this point you would like to share?
Because we're going to share the ones that we picked out.
Don will just pick
so
on
this
you.
is your chance. Okay.
Remember, we're all learning, and we wanted to make it, again, as educational. Just because we're here, the two of us yapping away, we want to make sure that, you know, you also have an opportunity to share your thoughts, ideas. This may be a connection that you will make here today. Somebody will bring something up, or, you know, use a buzzword that you want to continue to have a discussion after. So think about it that way as well. And again, the bigger picture, just we cannot emphasize enough that seat at the table to be successful. And I think that's a joint slide, but I'll let you down since you haven't
let
talked.
me go for a while? Okay.
Yes, go ahead.
Let me pass this.
Yes, please.
So having the seat at the table, building these relationships, I talked about that before. It's really a really important facet. If you're entry-level biomed rounding on the floors all the way to a VP or a director like Izabella, is having those connections. We talk about, we're going to get into from a biomed standpoint, you really could do yourself a good job by daily rounding or getting on to those EOC and safety committee meetings. Ask your manager if they're going to a meeting, can you go with them? Or if you are the manager, take somebody with you. You know, a little bit of succession training and getting them introduced to them. You want to make sure you can increase visibility and engagement with the department, period. We're a small department, right? I think that's one of the challenges I got down here is these are opportunities up here, you know, or these are opportunities to increase the visibility and engagement, right? Those are meetings you could join. Host an HTM open house. We got a cool little picture of an open house down here at HTM week is coming up.
Yeah.
Find a way to post that somewhere on your hospital's intranet or your company's intranet and get a big poster made and post it outside your department. Why not? Get people to realize who you are. A lot of biomet's always just said, IT gets all the talk and all the energy going toward IT. Sometimes IT departments are 40, 50, 60, 100 people deep, and we're 4 or 5 of us in biomet. So we're small compared to almost everybody, right? But we're really important, and we need to let people know that, right? So here's opportunities and strengthen connections, engage with hospital leadership by going to those meetings, build internal team relationships. I've been in leadership and management for many years. There's no reason you can't get to know your staff. I know that sounds kind of silly and maybe very intuitive, but I mean really get to know them, know you, have them know what you stand for, what your morals and your values are when you go to work every day, so they know how to react and deal and work on your jobs. I mean, your staff will follow you if they understand you and they know your voice. If they are just doing it because you tell them to, good luck. It's gonna be hard to really win them over. So your internal partners are really important. Again, we talked about those daily rounds and EOC. We put an individual through our phase 1 training recently, the daily round, and I really emphasized it to this individual. He is really shy and really introverted, painfully shy, painfully introverted. Almost came to tears when I told him he should go up and talk to the people on the floors, Great performer though, just a really great guy. And so I talked to him a couple months later and he started doing it. He's a single person site in a small hospital up in Wisconsin somewhere. And after about 3 months, he said, I can't believe what a difference this is making. I'm going up and around and I see them every day. Now they know my name. They know my girlfriend's name. They know my pets. I know all their names. And when I get calls now, it's easy. It's like going up and seeing a friend. So building those relationships, do this daily rounding, as painful as it might be to start, do it. Here's our challenges when it comes to this whole building these relationships with different other departments. We're small, right? And we want to change the perception from that repair team to a clinical partner. We are a clinical partner with them. We're in healthcare, right? That's why we've actually transitioned from like being under facilities maybe to being under IT. And then really a lot of the nursing staff, the nursing teams really, really depend on us. So, elevate yourself.
Before you go further, Don, just wanted to, engagement from the audience. Safety rounds, EOC rounds. Huntington introduced code sparkle rounds. Does anybody know what that could mean?
What does it say?
Code sparkle.
Code sparkle. Enlighten us.
A lot of emphasis, as you can imagine, on infection control, cleaning of equipment. That is becoming a routine question now in all the evaluations that we do for new medical equipment. Pretty much moving forward, infection control or infection prevention department is always part of any of our demos, product evaluations and so on, because you want to make sure that you have the right products, you vet out the cleaning methodology for the new equipment. So this is on the Huntington side, they introduced that code Sparkle. So actually, in addition to the environmental of care rounds, you round specifically and look at the compliance of equipment that is clean, because at Huntington specifically, it has to be bagged or it has to have a clean, like a green clean sticker on it to know that it's clean. So when you grab or a nurse grabs that equipment, they know that it's clean.
Right.
Not just because it's in the clean utility room, but if it's somewhere else, you know that you're grabbing a clean piece of equipment. So just wanted to see if anybody is involved in any of these rounds or do your own rounds. Do you do your biomed rounds?
I'm sure most people, again, a lot of shaking hands. I'm sure a lot of people go to the ELC rounds, right?
Or especially those that come in earliest, like surgery, cath lab support staff. I'm assuming you do some rounds in the morning to make sure everything is up to sniff, especially the anesthesia gas machines. If you're from an anesthesia side of it, everything is functional, nothing has unplugged overnight, which sometimes, we have those little gremlins that walk around and unplug equipment or power cords. So we want to make sure that obviously surgery starts early and on time and without any hiccups.
So you go to surgery, EOC rounds, are you a manager?
No, I'm the lead.
You're the lead, so good. So maybe you should try to, how many people you have working underneath you? Because I'm a firm believer in just bringing one of your ones or twos or just say, just go with this. The safety committee usually doesn't mind.
Yeah, you can do it.
Oh, good. Very, very good. That's very smart. Gets those other people engaged. Even if you do a different one every time, why not? Get them engaged. And that way, when you come back and you're talking about EOC rounds, you're like, he's just blowing smoke, you know. Talk about stuff over and over and over. You don't really actualize it until you actually go do it, right? Have them sit at those safety committee meetings in the back. Just say, come with me, just sit in the back, listen. What you got to do. Okay, communication skills. The most important skill in customer service is communication, of course. Right? Communication, again, I'm trying to find a different way to say soft skills or whatever about communication, life skills, emotional skills, whatever you want to call it. Because when you call it soft skills, it kind of gets pushed off to the side. And I'm not a believer in that at all. I'm a believer in this completely. And Izabella put a little bit of this slide together, so she's going to help me with this one. But you want to identify your customers. And again, everybody is your customer in the hospital. From the patient walking down the hallway that needs a place, that needs to find somewhere, to your coworkers, to the clinical partners, to everybody. Everybody is there to do a good job, right? And they're more your partners than your customers. Use customers here because that makes it easier for customer service discussion, but they're your partners, right? Treat them so and treat them with respect, right? Do you have the right customer satisfaction skill set, or does your staff need more training? I'm going to go ahead and go on a limb and say yes, your staff needs more training, right? Other than those evaluations or whatever we get every year that we have a meeting about every year to say how does your customer service, how's your customer satisfaction numbers. They always come back with, whatever it is, but we could do a little bit better. I think we can do better.
I think with that one, just to add on before you go to the next one, I think we always think of, because we're in a very, customer front facing in person. We go, to the actual floors, we talk to staff directly, but don't forget about when you do this kind of training to also include phone support, because there's phone communication as well, and that can sometimes not go in the right direction. And emails, right? A lot of things are done on emails or the virtual communication that we do when you're on Zoom or
Right.
Teams. Make sure that you also do that appropriately, because all of that is communication,
Right.
no matter what format. So we
And
want to make
depending
sure
on how
that we
you're
include
communicating within the hospital, because a lot of times text messaging are coming up on really,
Yep,
really important
that's
too.
true.
Get the emails and all
Yep.
that kind of stuff. So, and again, that's one of those things that are you really sitting down with your new hire or your technician saying, how are you communicating with the OR? How are they getting a hold of you? Is it a service request? Is it they calling your cell phone? How are you dealing with that, and how's that working for you? Because if you're not have that conversation, you're going to end up here. Damage control, right? Service recovery. How do you deal with service recovery? That normally falls onto a lead or a manager. Now you gotta kind of fix a service issue, right? How do you communicate with that? And who's teaching you and training you how to do that? Again, we're working on a leadership and communication and on a leadership management course as well. Because what happens to most of our good techs, they get promoted to manager or supervisor or lead without without much training, right? I fell into that trap myself, being promoted from a senior level to a lead to a manager. And I was kind of like, holy moly, I hope I could do it. But I was lucky enough where I was able to avail myself to all the training or manager training. And I live with a manager, so I got a chance to learn from her by osmosis. She's a leader, so I got her just by listening to her in her career. So I'm very lucky that I had some training already. But yeah, again, skill set and training is really important for us in this one. Oopsie. Opportunities and growth for HTM, customer service communication can be taught and learned, can be taught and absorbed in the right approach. You can do that right approach. There's a lot of extroverts and introverts in this field. I'm painfully extroverted. I cannot help but be extroverted. There's a lot of people like this individual I talked about in Wisconsin, painfully introverted. To have him say 2 words to us was really pulling teeth. We get a lot of introverts in this field. It's okay to be an introvert. Be who you are, be authentic, but you still want to be able to teach them and model them how to communicate. Understanding the difference between interpersonal and intrapersonal. Interpersonal is how you deal with people outside of yourself. The interpersonal is how you deal with things internally. Whether you recognize that you are kind of quiet and you have to step out of your zone, how you present yourself every morning. And I'm going to use a term that maybe you don't like, but if you're being a poopy pants all day long, and you wonder why people kind of respond to you that way, it's because you're poopy pants, right? If you actually have a upbeat and you're positive and you talk to somebody, you smile to someone versus being grumpy all day long, that not like you could really manage that out of somebody, but you can. I've had to pull people aside and say, why are you so grumpy all the time? You know, I don't know if it's a job requirement, but it certainly does require a conversation. I hate to say it. Elevating customer service by higher, we want to get higher employee we want the employee satisfaction numbers to go up. We like our customer satisfaction numbers to go up too, but if our employee satisfaction numbers are up, our customer satisfaction numbers will go up as well. Right? Happier employees, more engaged employees are going to make our customers happy. Right? Effective communication is going to bridge that gap between the HTM professionals and our clinical partners. I've been lucky. I've been able to see this in real time as a biomed, working in the ORs and working with RT, and then working as a leader. Having those relationships makes everything so much better. Work really hard at that, if anything else. Investing in new growth, and you want to invest in your new leaders. If you're a leader and you're an effective leader, find out who in your department is going to be your next new leader. Even have them self-identify. I want to be a supervisor someday. I want to be a manager someday. I want to be a director someday. Then start to work on that. Some people get promoted and they've never wanted to be a manager, and they get promoted anyways. They're like, gosh, I didn't want to do this, you know, but it gets forced upon them because of seniority and skill and whatever it might be. Being a great technician and being a manager are totally different skill sets, by the way. I'm sure you guys all know that. That's pretty intuitive. We all know that already.
Hey, Don, just so you know, we have about 8 minutes. The time has gone very fast.
Wow.
I know,
Okay.
so you better do some speed
You want me to do speed talking? Okay, challenges is HTM. Okay.
I do have a comment.
Well, here's the
after you're
deal.
done
I've
with
already
that
talked
slide.
about that.
Yeah.
Primarily a technical career. You know, teaching both new staff and legacy staff could be a challenge. The last thing I want to do as a new manager coming into your facilities are trying to teach you that might be a biomed for 25 years and come in and let's talk about communication. But newer staff, teach them new, teach them early. Can't do it enough. Need to find innovative and new ways to teach these crucial skills.
So just
And
quickly on that, before we move on, customer feedback. How many of you do some form of a informal, formal customer survey? Okay. What do you hear from your customers? If you're willing to share.
What do you hear? What are you asking them?
Couple of that stand out for our department. Very helpful. Very glad to work with them.
Oh, that's what you hear back? You don't have a formalized like card of like in these 5 things, 1 through 5?
I don't actually get to see the survey results. It's goes to our supervisor. They do recognize them during our weekly meetings. So.
That's awesome. How about you? You had your hand up back there.
The rain, some complaints, some turnaround time, which is standard in the field, but then same to echo,
Yeah.
outstanding text or response.
That's cool. I remember we used to send them out when I worked at Stanford years ago, and we used to get back, you didn't fix our toilet fast enough. I didn't fix your toilet fast enough. Or, you know, the lights were blinking and no one came up there like, they're getting this mixed up with engineering.
Yeah.
You know, so we changed our name back in data clinical technology because we were called clinical engineering and they thought we were engineering. Not that that's bad. Engineering's great, but of course we didn't fix your toilet. You probably could have though. I mean, really, how hard can the toilet be? Do you have anything else, Izabella?
No, I'm good. Yeah,
No,
we
go ahead.
can. Yeah.
The other picture wasn't blue or white.
What's that?
The other picture wasn't blue or white. So we should talk about. Go on.
Okay, Izabella, you your data driver.
Yeah. So this I think we can skip. I know this is another discussion slide to engage you guys, but I think we've talked a lot about the data and how important it is to have meaningful data with anything that we do. So we can move on for the sake of time because we have some other slides.
I'm going to go just 1 minute on this
we
slide.
should get through as well.
This one's blue. I'm going to go 1 minute. Opportunities and challenges. This is what I've talked about in leadership meetings and leadership council is using data instead of knowing what your department's really doing. If you're sitting behind a computer all day long and using data as the only indicator of how your department or individuals are doing, you're making a mistake. That's what I talked about. You need to know your staff. You need to know what they're doing. I know a lot of managers, I brought this up at a management council last year and I got a lot of pushback, but I held firm because I firmly believe it. You know, I'm managing 30 people. I said, you're managing 30 people yourself? Isn't that, how do you even do that? It doesn't make sense to me. To manage 30 people, there's no way they know what you're doing. And all you're doing is sitting behind a computer and pulling up, you know, productivity hours and maybe what's going on. I said, that's not right. It is a metric and it's important, but it's not the only metric. If you don't know what they're doing, it's important. So My feeling about the opportunities are great here. You can do a whole lot of stuff with data, important stuff with data, but losing touch with the work and losing touch with your staff, that to me is a challenge. And how do you do both? Use data and still engage with your staff and your hospital. It's really important. You don't want to lose that human element. Here's a networking skill. This is kind of fun because we both did 2 different slides. I'll let you go ahead, Isabel.
So I think that the networking piece of it, we talked a little bit about already, but I think one of the things, obviously, as you get involved, not just internally, I think I also would like to emphasize your external involvement. I mean, you're here, part of a conference. I don't know how many of you also attend any of your local state meetings. Amy, I know, is a big conference as well that based on budgets, not everybody obviously can go, and it takes on a different kind of angle of HTM as well, but please do get engaged. Find out who is the president or vice president or a member of the board of your local professional organization in your area. I think that's one good way to network and get to know people, especially some of you that may be looking at changing jobs or just entering the field. That is really a good way to get to know others. Actually, I always joke because Michaela is now the secretary within ACCE, and I said, well, this is the most prestigious position within ACCE. I started that way as well many, many moons ago, and really, it's amazing how many people you get to know by just sitting there listening to the conversations and getting to know what's going on, the relationships that some of those organizations have with other organizations, and really, 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 really starting your network. That I cannot tell you how many times, and Don can speak to that too, as we moved around within our jobs from state to state, you really tap into those networks. Because now, hey, I'm moving to New York. Who's there? Do you have any recommendations? How can I help you?
That's how I met you.
Exactly.
I called you and said, I'm moving to New York from California. Do you know anybody? And I made sure I met you at a conference 16 years ago.
That's the starting point. It works out, that's great. If not, perhaps that connection can lead to another connection. So that's kind of the gist of this. I don't know if you want to add anything.
Well, just show of hands, who's is this your first MD Expo conference? Well, that's awesome.
Great.
My son just raised his hand. I thought that was funny. I'm not surprised.
Well, it is his first.
It is his first one. So that's great. Keep coming. I mean, MD Expo does a really good job of really encouraging even staff level people, because it's free, right? If you're affiliated with the hospital, it doesn't cost you anything. You just have to show up. It's great. It's in the spring and fall. Amy is in the middle of the year, so please keep attending. And CMIA in California is very strong. Yeah. So no reason to start attending CMIA if you're in one of those 8 or 7 or 8 or 9 regions that goes to CMIA. Start jumping on with that. Okay. A little bit about networking. Again, we got such time limitations here. We know that getting your IT skills are really important, and I would say that do everything you can. This is my friend Brian here just got his CompTIA ITF Plus, IT Fundamentals Plus certification, which I'm going to look into that as soon as I get back home and have a few minutes. But you want to do everything you can to kind of start to engage in the IT networking world. Well, that's by formal education. We started a new training session. We're working with some colleagues from CBET and with our own team, our own IT team, to start teaching the fundamentals of IT to our technicians. From Biomed 1 to Biomed 3 and even leads and system engineers, we want to get that formal education to them. This is not a skill you just pick up by osmosis. You just don't know. Learning how to work on a vacuum pump and figure that out after a couple hours with one of your colleagues is different from knowing how to learn about IP addresses and learning about subnets and all that kind of stuff. So it's real important to start working on this, start building that in. Okay, I'm just going to go right past it. How to develop these skills on the job training. There's tons of certifications, right? The CompTIAs, there's Brian right there. There's a Network Plus, which is a little more involved. Security Plus. You see, but there's some IT involved. There's some really cool online courses here. You could jump right into if you're a LinkedIn online learning. What's that one? Emity is another one you can get onto and get some good IT courses. So jump in there and start learning, man. Just real basic stuff. Get in there and get involved. We've got a lot of slides here. Do you want to try to go through them real quick?
Yes, I will summarize. This is really the 3 R's that we talked about, kind of with preempting all this with the past and the present and the future. I don't know, if, like I said earlier, if anybody is not having any issues with staffing, as in, recruiting, recognition, retention. So I think one of the main things is, comparing the past, people were very, they were thankful to have a job, right? They would come every day and go home and then come again the next day and so on. Present time, we're starting to see a lot of options, right? People are when we were trying to recruit, the individuals looking at our job, they also have 10 other openings in the area that are very, very competitive. So obviously, they have a lot of options to choose from, with very high expectations. Future, obviously, we're hoping to look at, what are some of the predictive analytics that, including AI, that can help us make some of those decisions, better position ourselves with succession planning, so where possible, we can avoid all these open positions. Large retention incentives. I don't know how many of you do any type of retention incentives or sign-on bonuses, but that's almost a given now, right? It's an expectation. People don't just want to look at their basic hourly rate. They want to know the full package, in addition to all the benefits, medical benefits, and so on. So, and promotions, right? Nobody wants to stay as they enter the field in one job forever. They want to already during the interview as a tech one, they're already asking, the next 5-10 years is going to look like for them, whether it's at this institution or just, to get feedback from the person that's interviewing them. I mean, we get those questions as well. So
yeah, we're getting those a lot. I'm like, I'm a BOMED 1. What's it take to be a BOMED 2? What's it take to be a BOMED 3? I want it in writing.
To get there?
Yeah. And we're like, it's getting to be more performance-based, more than years of service-based.
Yeah.
Even though there's still years, I know a lot of hospital systems still have their JDs would require, like I worked at one hospital system, to even be considered for a BOMED 3 position, you had to be certified. And you wouldn't even be considered for that kind of promotion. I've seen someone to go from a 1 to a 2 is 4 years minimum. The next one's 8 years minimum. And then you can be considered to be a 3. You're telling a young candidate, hey, listen, you can be a senior level BOMED in 12 years from now. They'll be like, where's the next job?
I'm gonna go next door.
Yeah, exactly.
Yeah, exactly. And that's happening. And some of it is also driven by need that you may have in the department, right? To expedite some of those promotions, depending on, retirement or, LOAs or whatever that may be. I'll let you guys read through that. I was more about, remote hybrid that obviously was brought on by COVID and some of the satisfaction.
And this one kind of shocks you. This one kind of shocks you. 4.1 years the average time nowadays for people to stay within the job. And that's all jobs. I don't think that's got to do with medical repairers, if you will. That's how our job is classified. And I think the employment board or education, whatever, that EOD board. And there's some recruiting talent, right?
Yeah, which again, I'll let you guys read through that. I think some of it is pretty intuitive, and many of you, I'm sure, do some of that. Maybe some of you do some other creative ways to recruit talent. We've noticed, and right now on the Huntington side, looking for a Tech 1 position, options are available. But we also have a Tech 2 and a senior position open. And I can tell you our senior position at Huntington's been open now for a year and a half.
Are you recruiting right now?
I am.
Trying to
in
recruit
the last
people out of
1
here.
minute that I have, why not?
Jeez, Izabella.
Maximizing my time up here, but really it's becoming harder and harder. I don't know if any of you are seeing that as well. That's why we've talked about expediting some of those promotions, right? When that makes sense. So you can, start building maybe some of the more fundamental staffing that you need.
And I would say this one down here: ensure your benefits offerings are competitive. Most hospitals have educational reimbursement or bonuses for certification. Make sure that your staff knows about that, and actually you can use them, actuate them. We had an educational reimbursement. One of the facilities I was working at was only 4 classes they would take. I'm like, why not just open that up for conferences? None of my staff was going to conferences. I'm like, they have $2,000 a year they could use for education. Why not let them go to a conference and use that? So we changed that, made a little change with HR, and we were able to do that. So make sure your staff knows that that is actually there for them if it is for them, right?
And also CBET associated comp increase, right? Whether it's a one-time bonus or it's built into your perpetual salary. If you don't have any of that, and you have, obviously BMS that are interested in the, the CBET, CC, whatever, any of the other certifications as well, because we don't want to just be narrow-minded. Please do work with your management on that, because I think it's so important to have that available, because it's a good recognition and it's a good also compensation change. Recognizing talent, I think we've talked a little bit about that already. Just wanted to make a note on thank you cards. I don't know how many of you do thank you cards. You know, usually you just write thank you, or maybe it's already a pre-printed thank you card. But what's important, and I've learned that from one of the, I don't know, 2 presentations ago or so, handwritten note. Actually take the time, even if it's just 2 sentences, but 2 sentences coming from you, kind of on a personal, emotional, that EQ side of it. The employee will appreciate that a lot more. And sending it to their home, that's another piece of
A
information
little bit
that
of a
I've
hack,
learned.
yeah, it's a good
Because
hack,
then
yeah.
it could be their family also seeing it, right? It's not just that person that's going to get it at work, put it in their drawer and never see it again. It actually goes to the family home. So think about that as well.
Okay.
I
Here's some more
think-
stuff, but we're gonna go
Yeah.
ahead and skip right through all of this
Who
stuff.
doesn't want a Starbucks card, right? Some more statistics. We'll let you guys read that as well. We love gathering statistics, especially as related to, you know, all the topics that we talk about. So you can reference it, use it for your own presentations or conversations you have with your staff.
And believe me, here's retaining talent. This has been,
Yeah.
you know, one of the last R's. I mean, it's really important to
Yeah.
try to retain the talent you have. The cost of having to recruit and hire somebody else is very higher than
Mhm.
maybe even someone comes to me and says, I'm getting offered $2 an hour down the road to become BAMA too. It's worth having a conversation with anyways, right? You don't want to feel like you're being held over a barrel because someone's got another offer. Create a culture where they can come to you and talk to you. You maybe should know about that before they go down the street and get that job offer, but it happens to us all the time. It's just the nature of the business. People are going to come, people are going to leave. Let me see. We're going to keep moving a little bit.
I think we're almost at the end. One other thing, just I don't know if anybody has done this yet, but if you do have an open position that's longer, you know, than the usual, you know, what you would hope, 3 to 4 months recruitment, look at the salary ranges. Maybe you're not sized well when it comes to comp, and you're having problems being competitive. I know that has in the past for us, you know, open a door with HR and comp to see if there could be a global change for the department, not just for the particular
Right.
position that you're recruiting for.
This was a 2-hour talk, right? Or just 1 hour? Okay.
I think we've
at it, but
exceeded our time.
yes, we are exceeded. We had just a little bit of blurb here about training our leaders. We feel that's an opportunity and challenge coming up. We talked about that a little bit of trainers, managers getting some training. We have a little bit of talk on certifications and training here too. Make sure that your tech are professional development on their own. You as a biomed and a manager, do that yourself, lead the way. And we're gonna go to the EQ slide. Do you want to take it for a minute or do you?
That's okay. I think we've had a good discussion about EQ, so it touched on a lot
Oh
of those
boy,
points
and we even
already.
have more slides about this. So we're gonna go ahead.
Don,
and
you were
watch
on a
this.
roll.
There we go. What did we learn? We had the one slide we had there, I'm only going back to it because I think it's kind of coming aboard now. We got a lot of really good people that are doing some good stuff on social media these days. The last thing you want to do is see me start a YouTube channel. I might talk all day long about biomed. We have some really good people out there doing it. I feel it's really cool that they're doing it. We've been kind of waiting for a little bit of a breakthrough with some of our social media people. YouTube channels like, you know, Chase and Justin and Myrea down there, and the YouTube channel you guys have, the MD Expo YouTube channel, it's really good. It promotes our field, and it's kind of just cool enough where we can have somebody else listen to it and be happy with it. So, okay.
I think we're good. If you want to just put it towards the end, this is just a slide to remind all of you, not that we haven't reminded you enough, but there's somewhere HTM and the dates maybe.
There you go.
May 18 to 25, if you haven't thought about those dates yet, maybe this is a good time to start planning, maybe something for us as well, to think about a table or something special, open house. We saw the open house suggestions we had. This is a good time to, again, establish or reestablish those partnerships and put your name out there.
That's right.
So thank you. I know we went over time, but thank you for sticking with us.